Bruce Baltz is an internationally recognized expert with over 20 years' experience in the fitness and bodywork industry. He is a licensed massage therapist in New York and Florida and is the founder of Spirit Physical Incorporated. Bruce developed a workshop titled Deep Tissue Healing, The Art of Stone Massage, and has seen great success with his program over the past 5 years. His workshops are approved by both NCB, TMBA, Class A, and by the state of Florida. One of Bruce's greatest passions is the study and practice of Native American spirituality, whose principles made him aware of the importance of working with intent.
At this time, I'd like to go through and explain some of the supplies that we use in doing this deep tissue application of stonework. As most people know about hot stone application, many don't know about cold stones, because we use both in this modality. These darker stones here are lava stones or basalt stones. There's 27 stones in a set, various shapes and sizes to access different areas of the body. We have stones such as the effleurage stones to warm up the body in specific areas before we go in and do deeper work. We have larger stones that will be as a nurturing component of this deep tissue massage. And then we will have specialty stones, which are going to be more used for specific work in specific areas of the body. These two sets here are both from the same company, Desert Stone People, but there'll be no two sets alike. They have similar configurations, but none of these stones are cut, so it's what Mother Earth provides us, is what we've been working with. As far as the cold stones, these are all hand-carved stones. We have marble stones. In this set there's 19 stones. And then we have jade sets. These stones are primarily used for the original work of Mary Nelson's, although many of these shapes and sizes can be used in the deep tissue application as well. These stones also have a different hardness. The basalt stones are about a 7 on a hardness scale. The marble stones are around a 5 or a 4. The jade stones are also very hard, as the basalt stones are. So they give us a little bit more versatility because they'll take a little bit more pressure and we don't have to worry about chipping them in application. Part of this treatment is using stone heaters. There's many different choices that we have for stone heaters. The one that I choose to work with is one developed by Ember Products, which has a thermostat built into it, an on-off switch, and a drain as well, with a lid that is on a hinge. It just gives more of a professional appearance, I think, for what we're trying to represent doing this work. I'd like to introduce you to a new product that I was just exposed to, put together by a company called Performance Health. It's called ProSage. This is a product that was developed with the assistance of Eric Dalton and James Wazalski, who are two leaders in deep tissue work for massage therapists. Doing deep tissue work, we want to be able to grip the fascia. We want to affect the body on a deeper level. And we want to feel what we're doing when we're doing the work. And if you have too much oil, you can't feel through the stone, you can't control the stone. But what ProSage Heat does for me is that it brings heat into the treatment before I introduce a hot stone. So it prepares somebody for what they might receive, especially for those who have never received hot stone massage before. It kind of gives them a little introduction to the concept of applying heat into a basic or advanced deep tissue session. You'll find that if the oil is used in a proper amount, that you're not going to lose control of the stone and that you will grab the fascia and affect the body on a deeper level. The massage tables that I've been using for the past 10 years have been produced by Golden Ratio. I find that they're a sturdy, sound table and the foam is good density. And for this work, you need that type of padding because we're working deeper and harder, and so you want them to be as comfortable as possible. This is Angelica, so I'll be starting off working on her back. First, you'd want to get all the information that you would in any basic massage session on the problems or concerns that you might have for your client before you start a session. If there's medications involved, what they may be, any surgery or anything else that might produce muscular imbalances. I know Angelica's history, so I'm not really going to go through that whole process, and also since this is an introductory session. One thing we do have to be aware of, though, when we're working with temperature, contraindications are amplified. They're very similar to the ones that massage therapists have been taught in school and in their private practices, what they may have learned. But you just want to understand when you're working with heat, everything is amplified, and so it has to be done within their tolerance. Okay, so I'll start off by working on her back, and when I'm introducing stones to the body, I start with smaller stones first. You want to not overwhelm the system with too much heat. It's like getting into a hot tub. You don't just jump in. Nerves get adjusted to the pressure and to the heat of the stone gradually, so then you can increase it safely. The last thing we want to do is have an involuntary response that a client wants to protect themselves from your work, such as flinching because the stone's too hot or doing the same because the pressure's too deep. So you really want to be conscious of their pain threshold and work within that. I'll be using ProSage heat during this treatment. I find it's a good way to introduce temperature to the body before you apply a stone, which is also going to be hotter than what the ProSage heat will apply during the beginning of the session. And this oil happens to give a very good sense of touch to the body, and so the glide is very smooth and not too fast. I'm going to choose stones that are going to accommodate the body size and the areas that I want to access. Since we're just introducing heat to the body for the first time right now, I start off by taking out a few smaller stones, which I know are going to carry less heat. The first stone I'm even going to cool off a little bit so the body can get adjusted to the heat. The second stone I'll most likely leave out because it's going to cool off while it's on the table. It's a lot easier to get a stone started in an effleurage stroke when the slope of the body is dropping away from you. So I'll start on the lower back and I work the body in quadrants. I'll work on the lower back, and upper back. The reason why I do that is that a client can focus their energy in the area where they're receiving the treatment. It allows them to relax this area. And if they had a difficult time with the treatment, if it kind of pushed their threshold, then they're going to be able to relax more because they know once that section's done, I'm not going back. When I introduce the stone, it's always the back of my hand. And that is the only hand that I'm moving if I'm only working with one stone. So they know where the stone's going to be applied to the body first, and the shock value is not the same if you just apply a stone right away and they don't know where it's going to be coming from to start with. So it's the back of the hand, and I'll be starting on the side of the lower back. When you apply the stone, you want to make sure that it automatically goes into a stroke. The key to this technique is to bring rhythm into your work as if it was work that you're doing with your hands. So it has not changed. You want the work to flow. The stone case connected to the body. Whenever you place a stone in somebody's hand or you're getting ready to finish up with a stone, there should still be a little heat left in that stone. So now I'm going to slide the stone up the back, go down the arm, and it ends up in the client's hand. It keeps them connected to the treatment if I have to step away, and it also lets them be aware of what you're using because they might not have experienced this before. And so it just gives them confidence in your work. Now I'll be able to use the second stone I took out earlier because it's cool enough. When you first apply a stone to the body and it's hot, it's going to be a short, faster stroke so the client can take that heat. As soon as it starts to cool down the stone a little bit, you can slow down the pace. It's part of the nurturing aspect of this technique. The more we jostle the body around, the less relaxing it's going to be for the client. But I know if I want to work with a hot stone, initially it's going to be done at a fast, short pace. It's important to draw the stone back towards you because they don't feel the turn in the stone, and it also produces the essential technique to work with a hot stone. And then I switch the stone out from the other hand, and now they have a warm stone in that hand, and this one goes back into the heater. Stones should always be dried off before you take them to the table, because you don't want your client laying in wet linens. And again, it's going to be the similar procedure as before. I developed 3 different techniques to pin the stone to the body. One which is palming, which you saw with the basic effleurage stroke. I have a technique called trailing edge, and I have another one that I call cupping the stone. All the techniques take you away from holding the stone too tightly in your fingers. In this work, or I think in most body work, you got to work with both hands equally, and you have to change the angle in which you work. If you do this, then the things that might not be so biomechanically advantageous for you, you can get away with because you choose when you do them, and so you monitor them so you don't have any lasting effect as far as tendinitis problems may be, things that will be the end of a massage therapist's career. And I'm going to go back to the same area. Now I'm going to do a technique which is called trailing edge, but in order to do that on the lower back, I'm going to have to change my position. So I'm going to do a transition down toward Angelica's hip so then the stroke can go up toward the head. And at this time the stone is now in my outside hand, which it needs to stay in. So biomechanically when I turn around, the stone is in better alignment with my wrist. My hand can be in line with my wrist. So I walk with the stone, I turn it, and then it goes back in the opposite direction. The key to working with the stone like this is you cannot stop the stone. You stop the stone, and if it has a certain amount of heat left in it, it will be too much for the client to tolerate. So trailing edge is done with larger stones. I cup the front edge of the stone, and I'm bringing the trailing edge by pressing with the heel of my palm up through the erectors. This is a muscle stripping technique that goes quite a bit deeper into the musculature. And then again, when the stone loses enough of its heat, it comes back down the arm and back into the hand. Now I'll start with the same, so I'm going to do the same technique one more time on this side of the body with a new stone. So I'm going to choose again to start from the head of the table because I said before the effleurage stroke starts better in a downhill slope. So again now, the stone's a little warm so the pace is faster, then you start to slow it down. It's important to get the stone back into your palm. If it's too far out into your fingertips, your fingers flex back, the pressure is not adequate. So you got to get it back into your palm. So you can apply the pressure and lean into your stroke. Most of my pressure in my strokes comes from the core of my body, not from my arm solely. So again, I walk with the stone, it turns and goes back in the opposite direction. And then comes back down into the hand. When you're working in regions that are more backed up by bone, there's not as much muscle tissue to absorb the heat, you're going to be using smaller stones. And also, because of the spinous processes and the scapula, you don't want to aggressively go over those areas with the stone. It will hurt the client. So I'll take out 2 smaller stones so I can work in that area. And I know that I'm going to want to apply a little bit more oil now because some of the oil is absorbed into the skin too much for me to turn a stone fast enough. So with this first stone, I just put on just a few drops of oil. And I rub the stone in my hands, and then the excess oil that's in my hands, I wipe in the area where I'm going to be massaging. So it'll be in this area of the upper back. And again, now since I want to start a stone going downhill in a downhill slope, I want to face the head of the table now when I start my effleurage stroke. Because again, the body is falling away from me here. So it's the back of my hand, so Angelica will know this is where the stone is. Then I turn the hand over and the stroke starts immediately. You don't want to close your hand too much around the stone when you're flipping it. If I have to squeeze the stone and release it, it slows down the process of turning a hot stone. I am just basically grabbing the stone or catching it with my second knuckle and drawing my hand back toward me and flipping the stone on their body. So this way, my hand does not have to close on the stone and have another process that has to happen before I can apply pressure. The stroke can lengthen when the stone starts to cool down, but we still only want to turn the stone once. So it turns 180 degrees. As soon as it turns, the stone goes. It needs to represent the flow and the work that you currently do as a massage therapist. For instance, I'm sure if you're working with your hands, you don't do this when you're massaging the body. So this stone should stay connected to the body. I don't release it from the body to start the stroke. We stay connected the whole time until we either place the stone in the hand or tuck it underneath the body. And at this point, when I'm able to go this slow with a warm stone, it enables me to feel what's going on under the stone. So I will find those tight spots that I might want to sit with a little bit longer and let the heat soak in to relax the muscle more. The water temperature that you work with is pretty important in this technique. First of all, it has to be within your comfort zone as a massage therapist to handle the stone with confidence when you're working with your client, and it also has to be within their tolerance. The average water temperature that I work with is between 120 and 140 degrees. If I do heat the water up to 140 degrees, it enables me to take out more than one stone at a time, so I don't need to spend as much time going back and forth from the heater, but I'll definitely have to cool off the first stone, if not the first two stones that I take out when the water is at that temperature. But again, it's always within your tolerance and then your client's tolerance. All of us as deep tissue massage therapists have had clients that have come to us that have said that they want more pressure. You have to work within your own ability as a massage therapist. Otherwise, you're just damaging your body. We have a timeline as deep tissue massage therapists. We'll be able to work at this level. It's individual, but say 10 years. So our body mechanics and the stress that we put on our body should be minimized. One of the most important factors as being a massage therapist is working within our own abilities. So that would mean that we don't want to work with a stone that's hotter than what we can handle in our hand, because we're not going to transmit the confidence that we need to when we're doing the treatment. And we also don't want to put additional wear and tear on our body, which is going to happen anyway because of the choice that we've made to be deep tissue massage therapists. So my goal in this video is to help those who want to work with stones to put together body mechanics that are favorable for us so we can work longer. But the decision has to come from us to work this way. So if a client says to you, can you work deeper, and you know you're working within your limitations and you don't want to work any harder than that, then that client might not be for you. But that's a decision that we have to make, because I'm not willing to sacrifice my body for one client and then shorten my career as a body worker by 3 or 4 or 5 years. It just does not make any sense. So I'll be going on to doing a little bit more specific work here around the scapular region, since we've already brought enough heat to the area, so then I can work slower now with the stone that might be a little bit hotter. I have some effleurage stones in my set that might look like specialty stones, such as the one that I'm going to be working with right now. This stone that I'm working with is going to enable me to do some point work through the scapular region, but it's of a shape that I can still turn it. And since there's been enough heat presented to this area, this stone, I'm fairly confident, since I've worked with Angelica before, that she's not going to have a problem taking this heat. Once again, since I'm working on the upper back, I want the effleurage stroke to go in a down angle. It's easier to get the stone started this way, so the stroke's going toward the head at this time. Again, the back of my hand, so she knows where the stone's coming from. And then again, when you apply the stone, you want to make sure that it has room to have an initial stroke before you draw it back. And so it's going to be done faster now because it's a little bit warm. Now, as soon as it cools down, if you have firm enough pressure, you can slow the pace down. The pace changes with the hot stone. The pressure stays pretty constant because we're still talking about deep tissue work. Now, one of the things that you're going to want to do is change the angle of your wrist. If I work constantly with my wrist flexed and being on top of my strokes all the time, I promise you it would hurt your wrist because I know from personal experience it does. So at this time, I'm going to step back from my work a little bit and I drop my shoulder down closer to the level of the table. And if you don't have too much oil on the body, I can still lean into my stroke and not hold back, but I've dramatically changed the angle of my wrist. Again, it's one thing you need to do to protect yourself while you're doing massage work, is to be able to change the angle of your wrist. Now, with the shape of this stone, I can rock it up on its edge and I can do some point work. It's important whenever you do deeper work with stones to have your fingertips near the tip of the stone so you can feel through the stone better. That pressure is coming directly from my palm. So I'm not squeezing the stones with my fingertips. You squeeze them, you're going to wear your hands out. Pressure comes from the palm. Fingers just guide the stone so it doesn't slip out of its spot. And again, once I start to feel resistance, I know not to press any harder. And I just felt the muscle let go, and so I know I can press a little bit harder now. The muscle is now relaxing. And again, I always finish up a deeper stroke with just doing a little effleurage to calm the muscle back down again. Whenever you do deep work, you have to release it slowly. If you don't, then you can put the muscle back into spasm again. Okay, now I'll be using a scapula stone. This work I want to demonstrate for you, but it's not necessary for everybody to have this work done to them. And actually, Angelica doesn't need it that much because I want to work with the stone a little bit under the scapula, but in theory, we really don't need to stretch overstretched muscles. So I will do a little bit of this work just so you can see the body mechanics and how to access it. First thing I'll do is I'll take the stone out of Angelica's hand, because if I don't and I'm moving the arm around, she might drop it on my foot. So I'm going to place one hand in under the shoulder, but in a position where I can roll the humerus over. If I can roll the humerus over, the inferior angle of the scapula pops up. Then I'll take this larger stone and I'm going to start massaging it first into the area where I know I want to apply it. Then I'll be using the finer edge of the stone and sliding it in underneath the scapula. When we're doing the deep work on the scapula, underneath the scapula, it's not pokey work. It's done with rhythm and nice and smooth. So when you find tight spots, you can hold them. Let the heat soak in and do what it's supposed to do. I believe the healing in this treatment happens when we work slow and firm with the stone, so the client's body can relax more. Now when it's time to exit the stone from under the scapula, I just place my hand on top of the stone, press into the rhomboids, and the stone just slides out without plucking the scapula. Now since I applied the oil to the whole back to start with, and this side hasn't been worked on yet, I am going to apply a little bit of oil to this stone. And the reason why I apply it to the stone is because if I don't, I have the tendency to apply too much oil, and then I can't control the stone. In order to control the stone, you have to have an adequate amount of oil just to turn it if it's a hot stone, and not too much so you can't change your body mechanics. Again, the back of my hand. So I apply the stone to this area, again rolling it back toward me as I'm working with it. Then as it cools down, the pace slows down. And as this stone starts to lose its temperature, I'm going to come right back up the back with it, go down the arm, and place it in Angelica's hand. A very important component to what we're doing is the use of hot, but as well as the use of temperature being cold. So in this application, I can create or put enough heat into the body to simulate a fever. We've changed then that 98.6 place where our body likes to be. It likes to be at homeostasis. We take it out of it, it's uncomfortable with it. So in this process, we would like to pull the heat out of the body because the body soaks in heat, it does not soak in cold. When we place cold on the body, it pushes out heat. So in turn, I can release the heat from the body that we put in. Although the body strengthens from change, we just have to control how long that change is for. In other words, I work deeper than the client realizes, so I could make them sore. Cold stones are going to reduce the amount of soreness that that person might feel from the session because I've worked now deeper because they've been more relaxed. I can also, as I said before, change the core temperature of the body. I don't want a client to be nauseous getting up off the table, so I want to use cold to bring their body temperature back down again. In addition to that, if we can take the body out of its norm for a short period of time and it has to recover from it, it's only going to make it stronger, as long as the immune system is not being compromised. So in other words, I think this treatment can really be adapted to almost any condition that you might work on with just your hands. You just have to be smart about how you use temperature, introduce it gradually. You can always increase it. We can't take away what we've done. So if we made somebody sore, we made them feel nauseous, that's done. We can't take it back. Let's try not to go there with this work. When we're dissipating heat on the body, and I'm working on the lower back, I might be working in an 8 to 12 inch area. They have quite a bit of muscle density and length here to absorb that heat. All that heat's going into the palm of our hand. So we need to be able to switch hands to work with temperatures that your client are going to be able to absorb. Because across our knuckles and our palm, we have very little tissue to absorb that heat. So I like to work with hotter stones because I know it creates that hyperemia faster, so I can work deeper sooner into the muscle belly. So then that means I have to use both hands. And that's why very often I only work with one stone at a time. So then I can just flip the stone, switch it into the other hand, and the wrist is straight. Often I'll have the other hand on top to support the stroke, but there's usually one hand just turning the stone. You want that one hand turning the stone. You'll control it better, the pressure is going to be more even. And again, you lean into your strokes. Strokes do not just come from the arm. They have to come from the core of the body. If they don't, you're going to wear your body out sooner than you need to. It's very important when you're working on the body, as I stated before, not to squeeze the stone in your hand. And so when I go through this transition period where I want to switch the stone into my outside hand and then glide it up to the upper back to pull down off the upper traps, the stone is just cradled in my fingertips. If I turn it over, it's going to fall out. But we can apply it by just turning the fingers in toward the upper traps and just pinning it. Again, we pin the stone to the body, we do not hold it. And this being in the rhythm of a stroke, I don't mind releasing it from the body. But this is one of the only times that I'll do this. If you do it within the rhythm of a stroke, you can release it. You wouldn't do a stroke like this. But being that your other hand's involved, you can get away with it because it has rhythm. At this point, I can also either pull down on the upper taps to stretch them, to switch back into this hand, to continue the work on the upper back, or I come down and pull down on the upper traps, and then I can glide down into the hand. And again, now switch the stones out. Our body mechanics are very important as far as us being able to have longevity as massage therapists. From our table height to what ailments we might have that we have to deal with. If we have a bad back, if we have bad knees, wrists, we have to figure out the best way for us as long as we can vary it. If we get stuck in one position, that's where we have problems. So you just want to take that into consideration. Evaluate what you're doing as a therapist. Look at the way you're standing. Look at the way that you're working. And then be in tune enough to be able to change it. And that's what I try to share during these workshops. Just a quick review on the 3 different ways that I like to call pinning the stone to the body. Again, we talk about pinning because we don't want to squeeze it in our hands. We did the basic effleurage stroke, which we call palming, the pressure comes from the palm of the hand. Not too far out in the fingertips because it bends the fingers back. So it has to be back in a secure place where you can apply enough pressure if the stone is hot. We talked about trailing edge. That was when I wrap my fingers and just take the shape of the stone, not squeezing it in my hand, and able to bring my wrist back to bring the trailing edge of the stone up through the erectors or any other area that I want to work deeper on as a gliding stroke. Then we also have cupping the stone. I showed that a little bit on the upper back where the pressure came from my palm. So I am taking again the shape of the stone. There'll be another technique, a version of cupping the stone that I'm going to do now. But again, it's all about taking the shape of the stone. In this technique, I am going to wrap my fingers around the stone. But it's going to be still pinned to the body, so I don't have to squeeze it. Okay, now there isn't much heat in this stone, so I'm going to go right into showing you what the technique is. It's usually done from an effleurage technique as you're taking the heat out of the stone, and then I'm going to come to the side of the table. I've bent my knees and my arms are going to be rigid. The palms of my hand are resting on the client's body. It helps stabilize the stone. It forms what I would call a tripod. So I am now in the lamina groove with the stone. I've cupped it. My thumbs are not squeezing it. My thumb is out of the way. My other hand goes on top. I am not squeezing the stone. And by bending my knees, with my arms being rigid, it puts pressure into that stone. Then what I do is I shift my weight onto my front leg. And then I just rock the body nice and slow, pulling the erectors away from the spine. It's a nice, gentle stroke. And again, I release my hand and that stone would fall right out of it because I'm not squeezing it. Now, when I'm working the body in quadrants, that stroke will come out to about the mid-back area where I feel I can't go any further onto my front leg, which is fine. Then I can move my feet because I would start the stroke from about here if I was working on the upper back. And then again, I can rock the body with that stroke. Again, the pressure from the stroke is not coming from my fingers. I'm not doing this. It's stabilized with my hands, and the pressure or the rocking motion comes from my upper back. We want to use the largest muscle groups possible to apply these strokes. Our bodies will last longer if we do that. They will not wear out as quickly. Now, one of the things I've been working with very recently is using ProSage heat. So again, I'm going to take a little bit of the ProSage heat and I'm going to rub it in my hands, which kind of activates the heating properties. And then I'm going to take the stones and I'll place them on the table so I don't have to come back to the heating or drying station for them. When you apply cold to the body, you have to understand that your client might not be their most favorite thing, their most favorite experience. So working with cold stones, you have to apply direct pressure like with the hot stones, but the pace is slow, not fast. The body does not like being cold, but it's a really healing aspect of what we do. And so I will not do this session without doing cold. Okay, when you approach your client, it's going to be both palms up. And you're going to tell them that you're going to be working with cool stones, so it doesn't shock them. And you're going to have them take a deep breath. And during their exhale, you're going to apply the stones to the upper back. You want to take most of the cold out in the upper back because the lower back is much more sensitive to cold. So Angelica, take a deep breath and exhale. Now I'm applying those stones with quite a bit of pressure. And I'll hold these stones, especially on a client that I might not have worked with before. I want to see how they respond to the cool stones. And I'll wait until they start to relax into the cool, into the temperature that we're working with right now. And then I start to massage the upper back very slowly with the cool stones. And I'll bring them down into the upper traps and just work this area a little bit, nice and slow. Again, I step back from the table so I can lean into my strokes. Okay, now when we want to apply cold to the lower back, we go down the back with our palms up. And again, we want to work with the breath work because your client has a hard time contracting if they're exhaling. And so I'm going to have Angelica take a deep breath, and then during her exhale, I'm going to apply these stones to the lower back. So take a deep breath for me, and exhale. And we press and we hold. Now, depending upon how your client responds to cold is going to dictate the pace in which you can work with it. Angelica didn't seem to have a hard time with that, so I'm just going to come right up the back now with these stones. And I will end with this application. These two cool stones are going to go into her hands, and then I'm going to pick up the two marble stones to do one more application of cold. I'm going to be doing it the exact same way that I did it before, except during this application, I'm going to go down the back with the stones instead of going down with my palms up. Okay, deep breath, and exhale. But I will still massage the upper back first to take some of the initial cool out of these stones. Nice and slow with firm pressure. And then I'm going to flip them and draw them back. We can go out over the scapulas a little bit. Okay, now it's just to be firm pressure. Since she's already received cold once, the misnomer of how cold is going to feel is no longer apparent because she's experienced it already. And again, we just want to pull the heat out of the body that we put in it. We'll also reduce soreness. And it also takes the body out of its norm for a short period of time, which is going to make it stronger because it's going to just have to recover from it. It's like going to the gym. We break down a little bit of muscle tissue to get stronger. We're doing the same thing here, but on a cellular level or a systems level. And I'll go down the back one more time with these. Now when I come back, when I lean back into the stroke now, I still apply pressure because I know that cold stones without pressure can be a little bit shocking on the system. And again, I can go down into the hands and then switch the stones out. And at this time, I'll be going and working on the legs. And I don't spend as much time on the legs in an hour session because most people have their issues in their lower back or in their upper back or in their neck. I do address the legs, but for a short period of time, provided that there aren't any issues that a client has that we need to address. So you'll undrape one leg at a time while you're working here. Being that we're working on larger muscle groups through the glutes and through the hamstrings, we can work with hotter stones. We can work with larger stones. The body's going to absorb the heat better. I'm going to be taking out 3 stones at a time when I'm working on the legs. Some are going to be larger than the others. The smaller ones you're going to want to work with first because they're not going to hold the heat as long. And by the time you get to the last one, which is the larger stone, there'll still be enough heat in it to work with. So I'm first going to apply oil to the leg, like I did to the whole back when I started the session. And you're also going to want to apply a little bit to the bottom of the foot. So I'm going to take one of the smaller stones first now. Again, take the excess oil from my hands. I want to rub the stone a little bit because the last thing you want is a stone to stick when you're working with it. I usually place my hand on the sacrum because it pins the drape so it won't drop back over the upper hamstring and glute area when I'm trying to apply pressure to the stone. So again, we're starting closer to the trunk and I'm turning the stone at a rapid pace so the heat can be absorbed at a tolerable temperature for the client. And then as soon as I feel I can work with it slower, that's when the heat penetrates deeper into the muscle belly and when the healing really happens in this treatment. And then as I work on the glute some, I'm going to work my way back down into the hamstrings, and I'll be working on the IT band as well. It's important to always be behind the stone. You need to lean into your stroke, and to turn a stone that's too close to your body, if you're not behind it, you will have a difficult time turning the stone. Now I'm working on the inside of the leg. The inside of the leg is a little bit more sensitive to heat, so I would not go to the inside of the leg first. Always start on the outside of the leg. But then I'll switch to the outside hand, because it's the outside hand for the outside of the leg, inside hand for the inside. Now trailing edge and cupping the stone can all be used on the leg. Right now we can do trailing edge, bringing it right up the hamstrings, nice and slow. And also up the IT band. Okay, now this stone's lost most of its heat, so I'm going to slide off the leg and press it into the table and tuck it underneath the quad. Then I'm going to go for the next size stone down, starting in the hamstrings. Again, large muscle groups, they can take quite a bit of heat. Working on the legs is a good place to start working on your body mechanics to straighten your wrist out. As I drop my shoulder closer to the table, if my arm is kept in a rigid position, it's going to straighten my wrist out. And with not having too much oil, I can still lean into my stroke and not have to hold back. The pressure on the stone now is coming from my deltoids and my lats, large muscle groups. Again, we can switch into the inside hand, work a little bit more on the inside of the hamstrings, and a little bit on the adductors. Okay, we have one more application with the third stone. I use a larger stone on the lower leg, and I can also use it on the foot, because when you do trailing edge, working with a larger stone is easier. Again, I switched into the other hand. You don't want to have to cross your arm across your body. So if I switch to the inside hand, you can see the position that my wrist is put in at this point. It's not advantageous. I can't lean into my stroke, and it's an awkward position. It puts a lot of strain on your wrist. So make sure you use the inside hand. Same thing with the outside of the leg, outside hand. When I turn the stone, I'm rolling it on the body and just flipping it into the other hand, so the stone doesn't have to leave the body. Now when I want to transition to work on the foot, it's going to be a similar body position than when we transitioned working on the back when we wanted our stroke to go toward the head. So now the stone's in my outside hand. I walk with the stone, I turn it, I pivot my body, my hand comes in underneath the foot, the outside hand, stone stays in the inside hand, and I can do trailing edge through the bottom of the foot, and then I can also do point work with my fingertips near the end of the stone, pressure again coming from my palm. I'm going to be doing a cool stone application on the leg now after the hot, but it's not quite as important as it is on the back. For one reason, I didn't do my deepest work on the leg. I'm not concerned about making Angelica sore from this work. I'm also not concerned about changing the core temperature of the body and having somebody nauseous after the treatment, because the hot work on the leg is not going to affect our core temperature of our body. For the cold stone application on the leg, I'm just going to use one of the jade stones now that's large enough to cover more surface area because of the muscle groups that we're working on. So I'm going to put a little bit of ProSage again in my hands, and then rub the stone with it, and then apply my hands to the body. Again, Angelica knows what the cool stones feel like. Normally that wouldn't be such a great feeling for your client after I've had my hands in the cold water and then just apply them right to the body. But I've worked on her enough that I know that she understands what's about to come as way as cool treatment is concerned. Okay, again, I'm going to start closer to the trunk of the body. So, and I also still work with breath work. Angelica, please take a deep breath. And exhale. And again, I apply the stone first with pressure to see what my response is going to be as far as her tolerance for the temperature of the stone or lack of temperature of the stone. And again, I'm just working it nice and easy. I'm going to start moving my way back down through the hamstring and the IT band. Nice, firm pressure, slow. Now switch into the other hand, because biomechanically, when I want to work on top of the hamstrings or on the inner thigh area, it's a better position for me. My other hand, when I'm working on the legs, will either be on the inside or the outside. It will be the opposite from what the stone is, because people who relax enough are going to have, they're going to be relaxed in their hip, and the leg can rotate while you're working on it, which goes away from the pressure that you're trying to apply. So the hand on the opposite side of the leg can keep the leg from rolling, so your pressure becomes effective. And again, we'll just do a little bit of work in the calf, nice and easy, and slow. And you can take the stone to the bottom of the foot if you want, but again, if you're going to do that, stone's in the outside hand, pivot, do the similar application that you did with heat. Nice broad pressure, pinpointed if you'd like, to work specific points. Now there's a stone that's still placed underneath Angelica's quad, so I generally just do a connective stroke with my hands, going up the leg, and then any stones that are tucked or placed I remove as I come back down the leg. And then we'll be going on to work in a supine position, that meaning face up. We have Angelica now in the supine position, and so we're going to be working on the anterior leg. It's going to be a similar pattern of work which we did on the posterior leg. I'm going to take out 3 stones, 2 large or medium-sized stones and 1 small stone. But it's very important when you take stones out in that order that you move through the leg at a good pace, because I'm going to be working on the quadricep first. We want to start closer to the trunk of the body. So I'm going to be using the larger stones first. So I cannot overwork the stones at this point. We always want to have heat in the stone when we get done, so if we tuck it, there's still some warmth penetrating for the nurturing of the body. So the small stone that I'll be using last, I still want to have heat in it, so you have to work through those 2 larger stones at a faster pace. Okay, so we'll expose the leg that we want to work on, and we'll apply the Prosage heat first. After I get done distributing the oil on the leg, I'm going to place a belly stone and an occipital ridge stone, which is going to be part of the nurturing part of this deep tissue massage. We want the client to be able to relax and almost take themselves to a different place while you're doing this. And so if we can bring some tranquility into the treatment while we're applying the strokes of the deep tissue work, the client will heal faster and resonate with the work better. So I'll first take out one of the larger stones as a belly stone. In addition to, I'm going to take out an occipital ridge stone, which will be placed at the base of the neck. Now when you place a stone that's underneath the body, you must make sure that it's properly protected so it doesn't burn your client. Whenever they lay on a stone, the intensity of that heat is amplified greatly. Whenever you place stones under the body, you want to make sure that the client is in control of the temperature of that stone. Meaning that if at any time it feels too hot to them, you must remove it or wrap it. But that you have to give them the permission to say to you that stones are too hot or pressure might be too much. they're in control of the session. And so we have to honor whatever their tolerance is for heat, and we don't want to burn them. You get used to temperature as you lay on it, and you can get burned from it not knowing that it's happening. And then I'll be placing the belly stone as well. So just put your hand to your side. When you're placing the stone on the trunk of the body, you want to place it with respect to the client and for the energy in the stone. And so at this point, my hand's on the stomach to feel the breath, and the stone then will be placed during the exhale, because at that point the body's accepting that stone. Now that those stones are placed, I'm going to go ahead and start massage with the quadricep, with taking out 2 medium-sized stones. The first stone I'm going to cool off slightly, again because we're introducing temperature to a new area of the body now. And the other stones, by the time I get to them, will be the appropriate temperature to work with. Again, I always check the body to make sure there's enough glide so a hot stone, a new stone, does not stick. So I place the stone in the outside hand, and we're starting on the outside of the leg first, closest to the trunk. Is that temperature okay? And then as the stone starts to cool down, the pace slows down. And then I roll the stone on the body to work the inside of the leg and on top of the quadriceps. And at this time I'm going to step back to straighten my wrist out to reduce the pressure on my wrist. Leaning into your strokes, the power comes from the core of our body and from larger muscle groups. And as this stone starts to lose its temperature, I'm just going to tuck it into the table, and it's underneath the hamstrings now. And then I'll start with the next stone. Again, still working the quads, so larger muscle group, so I'm using 2 stones for this area of the body. When we're working on the lower leg, we want to be very conscious of tibialis, which protrudes out on the lower leg. It's a ridge. You don't want to run the stone over this portion of the bone. It also drops down on the inside of the leg where you'd want to access tibialis posterior. So you need a smaller stone to access these areas. When I start to work on the lower leg, I'll have the stone in my outside hand, but I control the leg at the heel with my inside hand. Present the stone to the outside of the leg, and then we're just working on tibialis anterior right now. Again, drawing the stone back and leaning into our strokes. Now, when I want to, I'll turn the stone up on its side, which is the cupping technique, where I'm pinning the stone to the body, and the motion to bring tibialis anterior slightly away from the bone is with my arm. It's not coming from my fingers. My fingers are not doing the work. The pulsating motion comes from my arm. My thumb is held rigid, but it's not squeezing the stone. And the pressure is coming from my palm to hold the stone in place. There's a space between tibialis anterior and tibialis. And so the stone is in that space. My thumb is the guide, so I do not put the stone on top of the bone, because that's very uncomfortable when you're running over bone with a hot stone. Then I'm going to do the similar technique on the inside of the leg, except this time working into trying to find tibialis posterior. My thumb is the guide again as the pressure comes from my palm, and the pulsating motion is generated from my arm, not my fingers. Then when I'm done with the leg, as far as the hot stone massage is concerned, I'll just do a little bit of work with my hands on the top of the foot. And then I want to connect the strokes that I've done. So I'm just going to do a nice glide, and then I remove the stones that I previously placed before I do the cold application. I'll be taking a medium-sized marble stone, to work the leg. Again, if the cold was a larger part of what I was doing for the leg right now, I would be doing more than one application. But the duration of heat was not long, and the depth of my work was not that great. So I'm not concerned about changing temperature or working too deep to create soreness. Put a little bit more Pro-Sage in my hand before I apply the cool stone. Okay, Angelica, take a deep breath for me. And exhale. Apply the stone, slow pressure. Leaning into your stroke. And again, I'll roll the stone into the other hand and hit a little bit of the inner thigh. And then bring it down to the lower leg. The pressure is slow. Pace is slow. Pressure is firm while you're working with cold. Then when I'm done with the cold application, I just glide off the foot. Another stroke up the leg to connect the work. And then we'll drape the leg. So now we're moving on to the arms, and I'm going to take out just one stone. So when you're working on the arms, you're going to be taking out a smaller stone. The surface area is not as large. I place the stone at the head of the table, keeping it far enough away from the head or the arm so if Angelica happens to move, she doesn't bump into a hot stone. Now I'll start on the shoulder. Again, I always present the back of my hand before I apply the stone to the body. Slowing the stone down as soon as possible. And I'll be working my way down to the forearm. When it's time to work the inside of the forearm, I switch the stone into the other hand, roll the forearm open. My neutral hand is under the wrist to keep the elbow from hyperextending if your client is prone to hyperextending their elbow. And if I get done working on the forearm, I go up to work across the chest. Stone's already in the correct hand. Open the arm up. Make sure your client's relaxed through the shoulder. Back of the hand, pressing into pectoralis major, running out onto the bicep. I want to continue the stroke. I just glide back up the body. I don't remove the stone from the body until I'm done working on the arm. Now I want to stretch the arm. Keep the traction, draw it across the body. Control with the inside hand at the elbow. The other hand's going to be massaging the triceps and the posterior compartment of the shoulder. When I get done here, I place the stone back on the table. Open the arm up, because I want to open the shoulder joint up a little bit to do some basic strokes when the shoulder is more accessible. You can also work tricep here. Now I want to stretch the arm the same way I did on the other side. Just pull the drape up a little bit. And then I lean back into the stroke, working with the restrictions, if there are any, in the shoulder, which I don't feel. I'll keep the traction. I reach down toward the hip, and then we stretch the obliques, leaning back on the arm to get a full stretch. Then I bring the arm back down toward the side. Remove the stone, and then we'll do the cold application on that arm. Again, I'll be taking out a medium-sized jade stone. You'll find that you don't have to be quite as slow when you're working on the arms as you do on the back with cold stones. It's just a lot easier for the client to adapt to the temperature on their arms and their legs opposed to their back. Again, I'm going through the same strokes that I did with the hot stone, applying cold to the same areas. And then I'll open up to come across the chest. Bring the arm back down to the side. And we'll be finishing up the treatment with work on the neck. Okay, now we're going to be going on and doing the neck. This is the portion of the treatment where I get to connect more with the energy of the client because I don't have to work as physically as hard. And so once I start the neck, I want to have everything that I need at the head of the table so I don't have to get up again. And I start off by taking the stone out from underneath the occipital ridge. Now I'm going to take out 4 stones out of the heater, 2 for each side of the neck. There'll be different shapes and sizes to access different areas and to do different techniques. I'll be starting off with the smallest stone first because again it's going to carry less heat. And I'm going to put the stones into the pillowcase that I removed from underneath Angelica's neck so I can wrap the stones up on the floor. It helps hold their heat until I get to them. And I do this work seated. And then I'll also bring the cold stones and put them on the floor. When I'm working the neck, I put a little bit of oil across the upper chest as well as on the shoulders. Because you can't really do the flipping of the stones on the neck that I was doing on the rest of the body. And this will be the only place that I do release the stone from the body while I'm applying the technique. Once I make contact with the body, I do not want to lose contact for the rest of the session. So there'll always be contact with one hand. I'm going to reach down and pick out the smallest stone first that I want to apply to the neck. And I place it on that side of the table that I want to start with, then I switch my hands so I wouldn't lose contact. If the stone's a little bit warm, you want to go to the shoulder first, because I can turn the stone here. And then as soon as it's to a temperature that I can work comfortably with it, I'm going to start applying it to the neck. When I'm doing the work at the neck, my arms are always resting on the table. It prevents me from having to shrug my shoulders in order to apply the stone. So it lets me work with less effort. Doing circles right now at the occipital ridge. This is accomplished by using both hands though. The hand on the opposite side of the head is helping me get this rotation right below the occipital ridge where we have many attachments. Now I do have to release the stone, but I cradle the stone in my hand using the bottom 2 fingers to pin it to my palm so that I can lift up into the upper traps, and then my arm rotates as it comes up to the occipital ridge, following the line of the upper traps. Then I take the point of the smaller stone, place it in the side of the neck in the lamina groove, and rotate the head into the stone. As soon as I feel resistance, I stop pushing the head, and I just let the heat soak in and release those muscles. I'm able to sense through the stone because my fingertips are at the edge of the stone. So I actually have contact with the skin with my fingertips. And I usually get 3 points before I hit the occipital ridge. When I get done working with the stone, it still has a little bit of warmth left in it. I'll end up tucking it, pressing it into the table and tucking it underneath the arm. And now going for the next stone, which will be a little bit longer for slightly different application. And again, I did not lose contact with the head. Again, I'm going to go to the outside of the arm here just because this stone's a little bit warm. And you want your client to know the temperatures that you're going to be working with. So I'm going to do the same sweeping stroke up the neck. With a flat stone of this nature, if I don't catch the hair, I can compress down into the upper traps and stretch. This stone being flat, I can flip it on the upper traps by releasing pressure, pushing through with my thumb, and reapplying. I'll also traction the neck, which is the cupping technique that we saw earlier in the lamina groove, pressing into the upper traps. Again, my stone is pinned, I'm not holding it, and I just scoop it up the neck to traction. The traction with the stone is done with my bottom 2 digits, so if it's a larger stone, I don't pull it up into the jawline. The pressure comes from underneath by the occipital ridge. The hand on the other side of the head just keeps the head from running away from me when I traction. I'll also take this stone and work in specific points on the upper traps. Being that it's a larger stone, I'll hold it flat into my palm. I just guide it and I press with my palm as I flex the neck to the opposite side, which pins the upper traps while I'm pressing into those points. I try to release them both together, come back to neutral, move out a little bit further, press and stretch again. And I'll usually get one more spot before I get out to the acromion process, press and stretch. Again, it's just coming from my palm. I do not have to hold the stone in my fingers. And then I'll usually finish up this side of the neck with some gliding strokes up the neck again. And I'll place this next stone just in her arm here. And then I'll be going on to the other side of the neck to do the same application. So I'm going to be starting on the opposite shoulder. Now the stones are not extremely hot anymore, so I'm going to start with the same application but going right into the stroke. So I lift up into the upper traps and it's gliding up the neck. Just want to open this area up a little bit first before you do any specific work. I can pin the upper traps to the stone and just let the heat soak in. And the work's nice and slow, deliberate, but not very pokey. You don't do aggressive deep tissue work. Your client will not be able to relax through that experience. Now I'm going to take one of the tips of this stone, again, in the side of the neck. And as I rotate the head, it presses into my palm, so I don't have to squeeze the stone tightly. And then I release it, move up a little bit further, and rotate again. be able to do that one more time before I hit the occipital ridge. And I'll just do another gliding stroke up the neck before I go on to the next stone. The stone that I'm choosing to work with last, I know out of the set of stones that I'm working with stays hottest the longest. So this is why I'm using it at this time. I can start the stone off with the traction of the neck, where I pin it into the upper traps, glide it up the neck, and traction. And I can use that broad surface also and massage the occipital ridge, but again the pressure comes from my bottom 2 digits. And then I'm going to pin the upper traps and move the head laterally. Just a pin and stretch. Now, this is a technique that I'm holding the stone, which is called the claw grip. The stone's a little bit shorter than the other one, so if I were to hold it in my palm, the stone does not come beyond my fingertips to use it in the style in which I use the other stone on the other side of the neck. So I turn my hand, my fingertips can be at the tip of the stone, and the pressure can come straight from my palm, so I don't have to close my hand around the stone. It just guides it. So again, it press and stretch. Then I release, press and stretch. Just want to pin the upper traps while we're putting pressure in. Just finish up with some gliding strokes. Okay, now I'm getting ready to use the cool stones on the neck. And so the cool stones are down at my other side, so I'm going to switch hands so I still keep contact with Angelica while I'm finishing up the session. So I'm going to take out 2 stones, one at a time. I'm going to place one on one side of the table. The second stone is going to be placed on the other side of the table. This is the only time I dry stones off on the table because I know after this application, Angelica is going to be getting up. So I dry the stone off, pick it up, then the back of my hand touches her shoulder, so then I can release the other hand from her head to get the other stone. Now both of them are at her upper traps. Okay, Angelica, you can take a deep breath for me. And exhale. You press into the upper traps and hold them firmly until you feel your clients adjusted to the temperature change. Now my hands are going to spin around on the stones, but the stones are going to stay stationary, which allows me to glide them up the neck. So I move my hands around the stones, cup them, and bring them up to the occipital ridge. Cold at the occipital ridge usually feels really good. And so I'm just alternating the stones with a little petrissage motion. I'm going to hit the same points that I did with the hot stones. I can pin the upper traps, holding the cold in on the bottom. I can turn the stones on their edges, work the spots that we did on the side of the neck, as well as working the points in the upper traps. Now there is a cold stone traction that I do with these stones, where I'll glide them both up to the occipital ridge. One hand's going to flatten out, press into the upper traps. My forearm comes into the side of the head, keeps it from running away from me, and then I pull with the stone on the opposite side. So it's a compression and stretch. Sometimes you'll catch hair when you do this, so you might have to reposition the stone. But now I release the pressure in the upper traps, bring the other stone up to the occipital ridge, and switch the pressure to the other side. Forearm in the side of the head, and then pull. With the stone on the opposite side now. Okay, and then we end these sessions. The session is not completed until you release the other stones from the body. What I usually do is tuck the stones in underneath the upper traps. There's not a lot of cold left in them. And then I kind of reconnect myself with the client. I'll do any face point work or point work that you may do currently to end your session, with any scalp massage that you might want to do. And then when that's done, I'll stand up from the table, go to where the belly stone was placed, place my hand on top of it. Feel for Angelica's breath while I'm doing this, because I want to release the stone at the top of her inhale. That means the body's giving the stone back to me. I'm going to inhale now. Top of her inhale, I lift that chakra stone up. My hand goes back down where that stone was. So you just don't release the stone and not close down where you've had it. And then the other stones are just released with respect. And then the two cool stones that were tucked underneath the upper traps. And that would be the end of the session, and these stones then are removed from the table. This technique is one that's going to take time to develop, and the process in which you develop as a therapist is an individual goal and journey. You have to work with these stones to experience what they're about, and it can be a very humbling experience for all massage therapists. When I've asked to put an object in your hand that you have not worked with before and asked you to feel through it, it's a transition that's going to take time as well as effort to get the fluidity into your work and confidence so your clients will trust the work, and the healing components of your work will increase as your technique improves with these stones over time.
For those practicing massage with the use of hot and cold stones, it is imperative to work within your abilities and the tolerance of your clients. By working within your level of competence, you may avoid your client resisting your work because of too much heat, cold, or pressure. The practice of deep tissue healing without proper training from a practitioner qualified to teach this modality can cause injury. Therefore, Spirit Physical Incorporated and Bruce Baltz, jointly and severally, cannot and shall not be held liable for any injury or other consequence resulting from the practice of deep tissue healing.